something that confuses many people: skincare ingredient lists. Learning to read and understand product labels empowers you to make informed choices about what you put on your skin. Looking at an ingredient list can feel overwhelming. There are long chemical names, unfamiliar terms, and dozens of ingredients in a single product. But with some basic knowledge, you can decode these lists and understand what you're actually applying to your skin. Let's start with how ingredient lists are structured, because this gives you immediate valuable information. In most countries, including the United States, ingredients must be listed in descending order by concentration. The first ingredient is present in the highest amount, the second ingredient is second most abundant, and so on. This continues until you reach concentrations below 1%, at which point ingredients can be listed in any order. This means the first 5 to 7 ingredients typically make up the bulk of the product's formula. These are the ingredients that will have the most impact on how the product performs and how your skin responds to it. Let's look at a hypothetical ingredient list: water, glycerin, cetyaryl alcohol, niacinamide, hyaluronic acid, ceramides, preservatives, fragrance. Water is the first ingredient, meaning this is primarily a water-based product. Water is an extremely common base for skincare products. It's inexpensive, a good solvent for many ingredients, and helps products spread easily. Glycerin is second, which tells you this is a hydrating product. Glycerin is a humectant that attracts moisture to your skin. Cetyaryl alcohol is third. Despite the name alcohol, this is actually a fatty alcohol that acts as an emollient and thickener. It's moisturizing, not drying. Don't confuse fatty alcohols like cetyaryl alcohol with drying alcohols like denatured alcohol or SD alcohol. Niacinamide appearing fourth means it's present in a meaningful concentration. This product will likely provide niacinamide's benefits: calming inflammation, regulating oil, fading dark spots, and strengthening your barrier. You can see how reading even just the first few ingredients tells you a lot about what the product is and what it's designed to do. Now let's discuss categories of ingredients and what to look for. Humectants attract and hold water. These are crucial for hydration. Common humectants include glycerin, hyaluronic acid, sodium hyaluronate, aloe vera, honey, panthenol, provitamin B5, and propylene glycol. If you want a hydrating product, look for humectants high on the ingredient list. Emollients fill in the spaces between skin cells, creating smooth, soft skin and helping repair your barrier. Common emollients include ceramides, cholesterol, fatty acids, squalane, jojoba oil, shea butter, and various plant oils. If your skin is dry, rough, or sensitive, emollients should be prominent in your products. Occlusives create a protective layer on your skin surface that prevents water loss. Common occlusives include petrolatum, mineral oil, dimethicone, beeswax, and lanolin. Very dry skin benefits from products with occlusives, especially at night. They're the seal that locks in all the hydration and treatment ingredients beneath them. Antioxidants protect your skin from free radical damage caused by UV exposure, pollution, and normal metabolism. Common antioxidants include vitamin C, L-ascorbic acid, ascorbyl palmitate, magnesium ascorbyl-phosphate, vitamin E, tocopherol, niacinamide, vitamin B3, green tea extract, resveratrol, and coenzyme Q10. Look for antioxidants in daytime products, especially when your skin faces environmental stressors. Exfoliants help remove dead skin cells and improve texture. We have AHAs like glycolic acid and lactic acid, water-soluble surface exfoliants, BHAs like salicylic acid, oil-soluble, penetrates pores, and enzymes like papain and bromelain, gentle protein dissolvers. Exfoliants typically appear lower on ingredient lists because they're effective at low concentrations, usually between 0.5% and 10%. Retinoids increase cell turnover, boost collagen, and prevent clogged pores. You might see retinol, retinol palmitate, retinaldehyde, or if prescription, tretinoin. These are powerful ingredients that appear effective even at low concentrations. Peptides are chains of amino acids that signal your skin to perform certain functions, often related to collagen production. Look for matrixyl, copper peptides, palmitoyl pentapeptide, and various other peptides. The science on peptides is still evolving, but many people find them helpful for firmness and texture. Now let's talk about ingredients you might want to avoid or be cautious with. Fragrances can cause irritation and allergic reactions. Fragrance is one of the most common causes of contact dermatitis. If you have sensitive skin or are prone to reactions, fragrance-free products are safer. Note that fragrance or parfum on an ingredient list can represent dozens of different chemicals, and companies aren't required to disclose what specific compounds they're using. Natural fragrances from essential oils can also be irritating, despite being natural. Citrus oils, peppermint, eucalyptus, and many others can cause sensitivity. Natural doesn't automatically mean gentle. Drying alcohols like alcohol denat, SD alcohol, and isopropyl alcohol can strip your skin and cause irritation, especially in high concentrations or with prolonged use. However, small amounts in a formula might not be problematic, and they serve purposes like helping products dry quickly or penetrate better. Context and concentration matter. Sulfates like sodium lauryl sulfate, SLS, and sodium laureth sulfate, SLES, are cleansing agents that can be harsh and stripping, especially for dry or sensitive skin. Many people prefer gentler cleansing agents like cocamidopropylbutane or sodium cocoyl, isethionate. Parabens are preservatives that prevent bacterial and fungal growth in products. They've been controversial due to concerns about hormone disruption, though research hasn't definitively proven harm at the concentrations used in cosmetics. If you prefer to avoid them, many products now use alternative preservatives like phenoxyethanol or sodium benzoate. That said, preservatives themselves are important. Products containing water need preservatives to prevent dangerous bacterial and mold growth. Preservative-free products must be packaged carefully in airless pumps and used quickly after opening. Let's discuss concentration. An ingredient appearing on a label doesn't guarantee effectiveness. Concentration matters tremendously. For instance, if vitamin C appears near the end of a long ingredient list, it might be present only in trace amounts for marketing purposes. This is sometimes called fairy dusting, adding trendy ingredients in tiny amounts that won't actually provide benefits just so they can appear on the label. For key active ingredients, you want to see them high enough on the list to indicate meaningful concentrations. If you're buying a niacinamide product, niacinamide should appear within the first 7 ingredients or so, not tucked away at the end. Effective concentrations vary by ingredient. For example, niacinamide is effective at 2 to 5%, vitamin C at 10 to 20%, retinol at 0.25 to 1%, and hyaluronic acid at 0.1 to 2%. You often can't tell exact percentages from ingredient lists, but position gives you a hint. Let's talk about buzzwords and marketing claims because these can be misleading. Clean beauty has no legal definition. What one brand calls clean might differ entirely from another brand's definition. Clean doesn't automatically mean safer or more effective. Judge products by their actual ingredients and how they perform for your skin, not by marketing labels. Natural and organic also aren't automatically better. Some natural ingredients are wonderful for skin. Others can be irritating or ineffective. Some synthetic ingredients are extremely effective and safe. What matters is how an ingredient works for your skin, not whether it came from a plant or a lab. Dermatologist tested sounds impressive, but means very little. It might mean one dermatologist used the product once. It doesn't guarantee effectiveness or safety. Similarly, clinically tested can mean almost anything. The testing might have been minimal or poorly designed. Hypoallergenic suggests a product is less likely to cause allergic reactions, but there's no standard for this term. It's largely marketing. If you have allergies, check the actual ingredient list. Non-comedogenic means less likely to clog pores, but again, there's no standard testing or definition. What clogs pores can be individual. An ingredient that's fine for you might cause breakouts in someone else. Let's discuss how to approach trying new products safely. First, identify your skin sensitivities. If you know certain ingredients cause reactions, check labels carefully and avoid products containing them. Keep a note in your phone of ingredients you react to so you can reference it when shopping. Second, patch test if you're concerned about reactions. Apply a small amount of the new product to your inner forearm or behind your ear and wait 24 to 48 hours. If no reaction occurs, try it on a small area of your face. If all is well after a few days, proceed with full use. Third, introduce one new product at a time and wait at least a week before adding another. This way, if you have a reaction, you'll know which product caused it. Fourth, remember that expensive doesn't mean better. A drugstore product with good ingredients can work just as well as a luxury product. Judge products by their formulations, not their price tags. Reading reviews can be helpful, but take them with perspective. Skincare is highly individual. A product that's life-changing for one person might break out another person. Reviews can indicate general quality and experience, but your own skin is the ultimate judge. As we close our time together, remember that becoming ingredient savvy is empowering. You don't need to memorize every chemical name or become a cosmetic chemist, but understanding the basics, how to read an ingredient list, what major categories of ingredients do, what to look for, and what to be cautious of, helps you make informed choices. Your skin deserves products that truly serve its needs, not just products with clever marketing. By learning to read labels, you become a more informed consumer and a better advocate for your own skin health. Take a deep breath in and out. You now have the tools to decode ingredient lists and choose products wisely. May you find products that truly benefit your skin. May you feel empowered in your choices. May you trust your growing knowledge and your skin's feedback. Thank you for this time together. Be well and choose wisely. Welcome, and take this moment to breathe deeply. Let yourself settle into peace. Today we're going to explore skincare for mature skin, understanding its unique needs and how to care for it with gentleness, respect, and effectiveness. Mature skin is beautiful. It tells the story of a life lived, experiences gained, wisdom earned. But it does have different needs than younger skin, and understanding these needs allows you to care for yourself optimally. As skin ages, several changes occur naturally. Let's explore these changes with understanding, not fear. First, your skin produces less oil. The sebaceous glands that produce sebum gradually slow down their production. This can lead to drier skin that feels less supple and may become more sensitive. The natural moisturizing factors in your skin also decrease, affecting your skin's ability to hold on to moisture. Second, cell turnover slows. When you're young, your skin cells renew approximately every 28 days. As you age, this process slows to 40, 50, or even 60 days. Dead cells linger longer on the surface, potentially create dullness and roughness. Third, collagen and elastin production decreases. These structural proteins give your skin its firmness and bounce. Starting in your 20s and accelerating through your 30s and beyond, your body produces less of these proteins. Existing collagen and elastin also break down from cumulative sun exposure and other environmental factors. This leads to fine lines, wrinkles, and loss of firmness. Fourth, your skin becomes thinner and more fragile. The epidermis and dermis both thin with age, making your skin more vulnerable to damage, slower to heal, and more likely to bruise. Fifth, fat loss in your face changes its contours. The fat pads that give youthful faces their fullness gradually diminish, leading to hollow areas and more pronounced facial structure. These changes are natural and universal. Every human who lives long enough experiences them. They're not failures or flaws, they're simply part of the aging process. However, how dramatically and quickly you age is partly within your control. Sun exposure is the single biggest factor in how your skin ages. Genetics play a role, but sun damage, smoking, diet, stress, and skincare habits all significantly impact how your skin ages. Let's talk about caring for mature skin with wisdom and effectiveness. The foundation remains the same: gentle cleansing, adequate moisture, and sun protection. But mature skin benefits from specific ingredients and extra attention. Cleansing for mature skin should be exceptionally gentle. Your skin is drier and more fragile than it once was. Harsh cleansers that strip away oil will leave your skin uncomfortable and compromised. Choose creamy, hydrating cleansers that clean without stripping. Oil cleansers or cleansing balms work beautifully for mature skin, providing gentle cleansing while leaving skin soft. You might find you don't need to cleanse morning and evening. Many people with mature skin do well with just water or micellar water in the morning, saving their full cleanse for evening. Listen to your skin. Hydration becomes increasingly important. With reduced natural moisture factors and decreased oil production, mature skin needs help maintaining adequate hydration. Hyaluronic acid becomes a valuable ally. It holds moisture in your skin, plumping fine lines and keeping your skin comfortable. Apply hyaluronic acid to damp skin, then seal it in with a rich moisturizer. Think layers: hydrating essence or serum, then moisturizer, possibly topped with a facial oil for extra nourishment and protection. Moisturizers for mature skin should be rich and nourishing. Look for products containing ceramides, which restore your barrier, peptides, which support collagen production, fatty acids, and occlusives that prevent moisture loss. Don't be afraid of richer creams. Your skin needs that nourishment now. Night creams are particularly valuable for mature skin. Richer than day moisturizers, they provide intensive overnight nourishment while your skin repairs itself. Now let's discuss active ingredients that specifically benefit mature skin. Retinoids are the gold standard for anti-aging. They increase cell turnover, stimulate collagen production, improve skin texture, reduce fine lines and wrinkles, and help fade dark spots. Retinoids essentially help your skin function more like younger skin. For mature skin, start with gentler retinoids, retinol or retinaldehyde, and build up slowly. Apply a pea-sized amount 2 to 3 times per week initially, gradually increasing frequency as your skin builds tolerance. Always use retinoids at night and follow with moisturizer. Your skin may be drier initially. This is normal and improves with continued use. Vitamin C is another powerhouse for mature skin. It's an antioxidant that protects against environmental damage, brightens skin tone, fades dark spots, and stimulates collagen production. Use vitamin C in the morning under sunscreen for daytime antioxidant protection. Niacinamide offers multiple benefits. It strengthens your barrier, reduces inflammation, evens skin tone, and may help with fine lines. It's gentle enough for even sensitive mature skin and works well with other ingredients. Peptides are chains of amino acids that signal your skin to produce more collagen. While research is still evolving, many peptide products show promise for improving firmness and reducing wrinkles. AHAs, alpha hydroxy acids, like glycolic or lactic acid, gently exfoliate, removing dead cells that linger due to slower cell turnover. This reveals brighter, smoother skin and enhances product absorption. For mature skin, use AHAs 1-2 times weekly with lower concentrations. Be gentle. Mature skin doesn't tolerate aggressive exfoliation. Well, antioxidants protect your skin from environmental damage that accelerates aging. Beyond vitamin C, look for ingredients like vitamin E, green tea extract, resveratrol, and coenzyme Q10. These neutralize free radicals before they can damage your skin cells. Sun protection is absolutely non-negotiable for mature skin. Every day, rain or shine, indoor or outdoor, UV radiation continues to damage your skin regardless of age, breaking down what collagen remains and creating new damage. Broad-spectrum SPF 30 minimum, reapplied as needed. This is the single most important anti-aging step you can take. Beyond topical skincare, consider these factors for healthy, mature skin. Hydration from within matters. Drink adequate water. Eat foods rich in antioxidants, healthy fats and vitamins. Omega-3 fatty acids from fish, flaxseed, or supplements support skin health from the inside. Sleep is when your skin repairs and regenerates. Prioritize 7 to 9 hours nightly. Consider a silk or satin pillowcase to reduce friction and prevent sleep lines. Stress management helps. Chronic stress accelerates aging through multiple pathways: inflammation, oxidative stress, and hormonal changes. Whatever helps you manage stress, meditation, exercise, hobbies, therapy, benefits your skin as much as your overall health. Gentle facial massage can support mature skin. As you apply your products, take time to massage gently with upward strokes. This stimulates circulation, encourages lymphatic drainage, and can help reduce puffiness while providing a moment of self-care. Don't neglect your neck, chest, and hands. These areas show age prominently but are often forgotten in skincare routines. Extend your facial skincare down your neck and chest. Apply hand cream with SPF throughout the day. Professional treatments can complement home care. Regular facials, chemical peels, microneedling, or laser treatments can address specific concerns. Work with a qualified esthetician or dermatologist who specializes in mature skin. Let's address expectations realistically. Skincare cannot reverse aging entirely. It cannot eliminate deep wrinkles, restore lost volume, or turn back time. What it can do is improve skin health, texture, and tone, minimize fine lines, even pigmentation, and help you age more gracefully. If you're hoping for dramatic transformation, you may be disappointed. But if you're hoping for healthier, more comfortable, brighter, smoother skin that reflects good care, that's absolutely achievable. Results take time, months, not weeks. Be patient and consistent. Some improvements you'll notice within weeks, better hydration, improved texture. But significant changes in wrinkles and firmness require months of dedicated care. Finally, let's talk about acceptance alongside action. Caring for your mature skin is valuable and worthwhile, but your worth isn't determined by how few wrinkles you have or how youthful your skin looks. Aging is a privilege denied to many. Your skin tells your story. Honor it while caring for it. Use skincare to support your skin's health and comfort, not to wage war.
Or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking.
Welcome, and breathe deeply. Settle into calm. Today we're exploring the world of face masks, these special treatments that can boost your skincare routine and provide targeted benefits. Face masks have been part of skincare traditions for centuries across many cultures. Today, the variety of masks available can feel overwhelming. Sheet masks, clay masks, gel masks, overnight masks, peel-off masks. Each type serves different purposes and works in different ways. Understanding what each type of mask does helps you choose ones that actually benefit your skin, rather than just following trends or accumulating products you don't need. Let's explore the main categories of face masks and what makes each unique. Clay and mud masks. Clay masks are perhaps the oldest type of face mask. They've been used for thousands of years because they work effectively for certain skin types and concerns. Clay masks contain various types of clay or mud: kaolin, bentonite, French green clay, Dead Sea mud. These clays have absorbent properties. When applied to your skin, they draw out excess oil, absorb impurities, and can help clear congested pores. Clay masks work best for oily or combination skin. If you have dry or sensitive skin, clay masks might be too drying unless you're using them only on specific oily areas, like your T-zone. Application is straightforward. Apply an even layer to clean, dry skin, avoiding the eye area. Leave on for 10 to 15 minutes. The mask will usually dry and tighten on your skin. Rinse thoroughly with lukewarm water. Always follow with moisturizer because clay masks can be temporarily drying. Use clay masks once or twice weekly, not daily. Overuse will strip your skin and potentially cause more oil production as your skin tries to compensate. Cream and gel masks. Cream masks are moisturizing treatments, rich in hydrating and nourishing ingredients. They don't dry on your skin. They remain creamy and are either absorbed or rinsed off after 10 to 20 minutes. These masks are excellent for dry, dehydrated, or mature skin. They provide intensive hydration and can contain beneficial ingredients like hyaluronic acid, ceramides, peptides, or antioxidants. Gel masks are similar but lighter in texture. They're often cooling and soothing, making them suitable for all skin types, including oily skin. Many gel masks focus on hydration, calming inflammation, or providing antioxidants. Application. After cleansing, apply a generous layer to your face. Relax for 15 to 20 minutes while the mask works. Remove any excess with a damp cloth or rinse off gently. Follow with your regular routine. Cream and gel masks can be used 1 to 3 times weekly, depending on your skin's needs and how your skin responds. Sheet masks. Sheet masks have gained enormous popularity, particularly from Korean and Japanese skincare. A sheet mask is a fabric or fiber sheet saturated with serum or essence, shaped to fit your face. Sheet masks are convenient and mess-free. The sheet keeps the serum in close contact with your skin, preventing evaporation and allowing extended absorption time. They come in countless varieties targeting different concerns: hydration, brightening, firming, soothing, clarifying. The effectiveness depends entirely on the quality of the serum the sheet is soaked in. Application is simple. Unfold the sheet and place it on clean skin, smoothing out air bubbles. Relax for 15-20 minutes. Remove the sheet and pat remaining serum into your skin. No need to rinse. Follow with moisturizer to seal in the benefits. Sheet masks can be used whenever you want extra hydration or treatment. Some people use them daily, others once or twice weekly. Overnight masks. Sleeping masks or overnight masks are leave-on treatments designed to work while you sleep. They're typically gel or cream formulations applied as the last step of your nighttime routine. These masks focus on intensive hydration, repair, or treatment. They're formulated to stay on your skin for hours without feeling heavy or transferring excessively to your pillow. Many sleeping masks contain occlusive ingredients that seal in all the products you've applied underneath, allowing them to penetrate deeply over hours rather than minutes. Application. After your regular nighttime routine, apply a thin to moderate layer of sleeping mask. Allow it to absorb slightly, then go to sleep. Rinse off in the morning if needed, though many sleeping masks absorb fully overnight. Use 2 to 3 times weekly or every night depending on your skin's needs and the specific product. Exfoliating masks. Chemical exfoliating masks contain AHAs, BHAs, or enzymes that help remove dead skin cells. Some contain physical exfoliants like fine particles for gentle scrubbing. These masks improve skin texture, brightness, and can help with clogged pores or rough patches. They're more intensive than your daily exfoliation products. Be cautious with exfoliating masks. Start with gentle formulations and infrequent use, once weekly. Observe how your skin responds. Never use exfoliating masks on the same night as strong retinoids or other potent exfoliants. Application varies by type. Follow product instructions carefully regarding timing and removal. Always follow with moisturizer and use sunscreen diligently the next day, as these masks increase sun sensitivity. Peel-off masks. Peel-off masks dry to a rubbery consistency and are then peeled away from your skin. They often claim to remove blackheads or impurities. Honestly, peel-off masks are more satisfying than truly beneficial for most people. They can remove some surface debris and dead skin, but they can also be irritating and don't deeply clean pores as claimed. If you enjoy the sensation and ritual, that's fine, but don't expect dramatic results. Avoid peel-off masks on sensitive skin or if you have facial hair, as peeling can be uncomfortable. How to choose the right mask. Consider your skin type first. Oily skin benefits from clay masks and clarifying treatments. Dry skin needs hydrating cream or gel masks. Sensitive skin should stick to gentle, soothing masks. Combination skin might use different masks on different areas. Consider your goals. Need hydration? Choose hydrating masks with hyaluronic acid or ceramides. Want brightening? Look for vitamin C, niacinamide, or gentle AHAs. Need calming? Choose masks with centella, aloe, or chamomile. Read ingredients, not just marketing claims. A beautiful package doesn't guarantee an effective mask. Look for beneficial active ingredients high on the ingredient list. Consider convenience. Sheet masks are travel-friendly and easy. Clay masks require more cleanup but can be highly effective. Choose what fits your lifestyle. Making masking effective. Always apply masks to clean skin. Cleanse thoroughly first so the mask ingredients can penetrate rather than sitting on top of dirt and oil. Time your masks appropriately. Don't leave them on longer than recommended. This won't increase benefits and might cause irritation. Set a timer so you don't forget. Create a relaxing environment. Masking is an opportunity for self-care. Dim lights, play calming music, rest comfortably. The relaxation itself benefits your skin through stress reduction. Be consistent, but don't overdo it. Regular masking, weekly or a few times weekly, produces better results than occasional intensive masking sessions. But using multiple different masks daily can overwhelm your skin. Patch test new masks if you have sensitive skin. Apply a small amount to your inner arm. Wait 24 hours and check for reactions before using on your face. Common masking mistakes. Using masks on dirty skin defeats the purpose. Always cleanse first. Leaving masks on too long thinking it's better can actually dry out or irritate skin. Follow timing instructions. Using harsh masks too frequently strips your skin and causes irritation. More isn't better. Appropriate frequency is better. Not following with moisturizer after masks that should be rinsed off leaves skin vulnerable to moisture loss. Expecting instant dramatic results leads to disappointment. Masks provide benefits, but they're not miracle workers. Consistent care over time creates real change. Budget-friendly masking. Expensive doesn't automatically mean better. Some affordable masks have excellent formulations. Read ingredient lists and reviews. Multi-masking, using different masks on different facial areas, allows you to address multiple concerns without buying multiple full-sized products. Use clay on your oily T-zone, hydrating mask on your dry cheeks. Making simple masks at home can be effective and economical. Honey and yogurt create a gentle hydrating mask. Oatmeal and water soothe sensitive skin. Keep homemade masks simple and don't expect professional results, but they can supplement purchase masks. When to mask. Many people prefer evening masking.
Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months. Get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen-causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible, though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian skin, rosacea, and acne in East Asian populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in 𝒏𝒆𝒐𝒗𝒊𝒏. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝒐𝒊𝒏 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms